Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. Happy New Year to all. We are in January. Can you even believe it? It seems like 2021 just flew by as we were just waiting for things to happen and hopefully getting some changes. But I hope everyone had great holidays, and I hope you're ready to start the new year off with a bang. So we also want to say a shout out and hello and Happy New Year to our Coding Corner member clients. The membership has grown, new and existing, and we had a great surge in membership the last month. So I really appreciate that, and we're so happy to have you. Again, for those who are interested in becoming a Coding Corner member, please go to terryfletcher.net, click on services at the top, and it's the first option that you choose to join. So what that is, basically, for those of you that are not aware, it's a question and answer forum where you can email me questions and we respond to them within 24 hours on coding, billing, reimbursement, compliance, whatever question you have, and you can see what specialties we offer on our website at, again, terryfletcher.net. So back to the podcast. So today's topic, as we ring in the new year, I'm going to give you an update on what is now effective and to clear up some confusion on other implementation dates. Because after a few emails I've gotten in the past week, I'm thinking it's pretty clear that not everyone reads the entirety of some of the rules that are out there. And we want to make sure that you have them. Otherwise, it can come back to bite you later in the year if you only read the headlines and thought things were pushed. So let's make sure we understand what's going on. So first of all, the public health emergency as of today, which is your January 4th, it is still on a go, I should say, until the 20th of January. So we're still waiting. We go to phe.gov all the time to figure out if they've updated it. I have a feeling they're going to do what they always do and update it, 4 or 5 days before. They usually do it on a Friday night or a Saturday, but you can also keep checking as well. It's weird because about 2 months ago, I would have thought that they would have said, oh yeah, it's going to keep going. The Omicron virus, which is the variant, another variant. We're going to keep having variants, let's face it, is there and it's surging. And so they're going to say we're in a public health emergency forever. But they can't do that. They can only renew it every 90 days. And so we'll see if they renew it because honestly, in my opinion, I think we're in an endemic. So we already have we have the vaccines, we have the boosters. It's also available for kids, which is controversial. But basically, anyone who wants a vaccine can get a vaccine in this country for free. And so that's where I think they have to really look at that from a point of when are we going to end the public health emergency so that we can understand that what regulations are not temporary. But as of right now, it's still there. The Medicare physician fee schedule was adjusted. Many of you that took my Medicare update webinar in December, I had 4 of them, will know that they did adjust by delaying some sequestration deductions. They didn't stop them, just so you know, they just delayed them. So the 2% is delayed until March, and then it goes down to 1% from March until June, and then in July goes back up to 2%. And then also the 4% from that, $1.9 trillion American Rescue Plan, they're going to take 4% out of the Medicare fee schedule starting in January 2023. That's why when they say, things it doesn't cost you money, it's not true. It does cost money, and it costs it from taking out of public agency services. So that's a bummer. So what is our current fee schedule conversion factor? And this is our multiplier that we use to figure out the allowable for Medicare services, or I should say any services, but under the Medicare fee schedule. So they came out, they republished it because of the delays, and it's $34.60. Okay, so in 2021, it was $34.89. So it only went down about 29 cents, but you'll still feel it a little bit. I also don't understand how they did their math, because I looked at just reducing it 0.75%, and that actually went to $34.62. So I'm not sure where we lost 2 pennies, but apparently we did. So $34.60 is your new multiplier. Now, what happened with the Omnibus vaccine mandates for CMS? Okay, so this is a really interesting guidance that they gave us. So there were 25 states out of 50 that that actually put a lawsuit out there, that filed a lawsuit against CMS, saying that it was not only going to hurt the population of staff that they have, so it was really going to deplete staff for frontline workers that had already been exposed to the virus and didn't feel that they want to get vaccinated for whatever personal or whatever reasons. And so they were let go because they didn't follow the rule for the guidance for the mandates. And so all these different things. And so different states had definitely filed a lawsuit. Well, here's what they put out. And I just thought this was weird. So they said guidance for the interim final rule, Medicare and Medicaid programs, Omnibus healthcare staff vaccination. So these are for the covered entities. So anyone who works at certain healthcare facilities that are under the they're considered certified providers. And so they actually have to, for the Office of Compliance, so they actually have to, for compliance reasons and to get paid, they have to be vaccinated and their staff. So what it said is that CMS is committed to ensuring that healthcare facilities respond effectively to the COVID-19 public health emergency, and they went on about the final rule, IFC as well, and comment period. So they're saying that anybody that, and a judge came out and said this, so they put it on a stay, and now they said that anybody that did not file a suit, so this does not apply to Alabama, Alaska, or I'm sorry, who did follow suit. It applies to Alabama, Alaska, Arizona, Arkansas, Georgia, Idaho. You can look this up. But basically, they're saying that if they didn't file a lawsuit, they have to follow the guidance for the mandates. If they did file a lawsuit, those states, it says that they don't have to follow it. But they don't even say they don't have to follow it. Listen to what they say. Surveyors in these states, those are basically the mandate police, I guess, should not undertake any efforts to implement or enforce the IFC. Implement or enforce. I get the enforce, so you're not going to fine people, but at least not to make sure everybody's being safe. That's weird to me. So anyway, if your state was one that filed a suit, then you don't have to be the one that is the forced or vaccine mandate coverage. But it doesn't mean that they're not going to try again in a little while. So just be careful with that. Basically, you'll need to do what your employer tells you to do. So kind of look to that as far as your guidance on there. Okay, so the NSA, the No Surprise Act. Okay, so that basically becomes effective January 1st. It means that you have to fully disclose to insured and uninsured patients what their out-of-pocket will be. You have to have a pricing list. If you're doing hospital procedures for patients, then you have to make sure that their out-of-pocket is in line with a patient who would be part of one of your plans. Let's say that you're in network, because they are not going to be subject to out-of-network surprise billing anymore. There's a lot of nuances with that, so make sure you find a webinar. I know I have some coming up. There's a lot coming up on that, so check on my website and we'll make sure that we get you informed on that. So we did a few last year, and you really needed to read up on as much as you can. There's also articles on ICD-10 Monitor regarding the No Surprises Act, not just only from me, but from Dr. Erica Reamer and different authoritative resources. So make sure you're reading up on that, because that takes effect on January 1st, and there's a lot of confusion on what is actually accurate. Another thing that is now an issue is something called the AUC. So what is that exactly? That is the Appropriate Use Criteria Program. It's basically a pre-authorization program or a pre-certification program that uses something called a clinical decision support mechanism. And what this is they put it under the Protecting Access to Medicare Act, but it's under the Social Security Act. It was actually of 2014. And when you have advanced imaging services like CT scans, PET scans, nuclear medicine, so shout out to all my cardiology people out there, MRIs, anything like that. Under this program, at the time a practitioner orders an advanced diagnostic imaging service for a Medicare patient, the physician or clinical staff under their direction is required to consult what they call a qualified CDSM. That is a qualified clinical decision support mechanism. It's an electronic portal or website which the AUC, the appropriate use criteria, is addressed. So you basically punch in the diagnosis for whatever the order came in for the patient to have that done, and the CDSM provides a determination of whether the order adheres to the AUC or if the AUC consulted was not applicable. So also I think there's 13 of the CDSMs, and if one doesn't take your information and give you the number you want, you can actually try another one and see what they say. So practitioners who are ordering these, they're actually going to look at their patterns, and they're going to be considered outliers if they do not use these. So what's the current rule? Well, in the final rule for 2022, it has to be fully implemented on the latter of either January 1st, 2023, or the January 1st that follows the declared end of the public health emergency. But it's been implemented on a voluntary basis since January 1st, 2020. And then what has been delayed is actually the penalty phase. So do you need to be implementing this now as of January 1st? You actually do. And you have to read through all that to actually find it. So make sure that it's fully implemented as of 2023, but you need to start implementing this as an education and operations testing period. You need to start implementing this within your practice. And, it's anybody, basically, it impacts all physicians and practitioners that order advanced diagnostic imaging services or who furnish those diagnostic imaging services, whether it be a hospital outpatient or inpatient department, a physician's office, an ambulatory surgery center, or an independent diagnostic testing facility, so an IDTF. But anybody who schedules these services needs to make sure that they have this implemented no later than 2023, but you need to start doing it as of 2022 because what's actually been delayed is the penalty phase. So they're not going to penalize you until 2023, but they may be keeping track as if you're providing it or not. So make sure you look that up. All you have to do is go to cms.gov, put in Quality Initiatives AUC program, and it'll walk you through step by step. But that is actually a really big one, especially for cardiology, primary care, and practices who are in the hospital. Now, there's something else that became new for orthopedic practices, and I thought this was crazy. So this is a patient who shows up in the ER. They basically let's say they get splinted or they have a fracture, but the ER doctor doesn't set the fracture. All they do is put them in a splint or put them in a cast and then give them a referral to an orthopedic practice. Well, they've always traditionally reported that as an ER visit and then the strapping, casting, or a sling. Well, as of 2022, they're now allowed to report it as the global, believe it or not, fee with the 54 modifiers. So that doesn't include the pre and post-op work, which will really hurt the orthopedic physician moving forward because now the orthopedic physician won't know. They won't know how it was reported. And let's say that patient now comes to your office and the doctor, sets a displaced fracture or does more fracture care as far as the mobilization of that than what was done in the ER and tries to code for a global service, it'll get denied because it was already billed for. So if your staff really needs to know where the patient was coming from, if they were coming from the ER and just referred randomly to your practice, so that you can, adjust accordingly, because that's not only going to be a loss of revenue, but you don't want to see denials based on how the ER doctor billed and what you thought you could get paid and now what actually happens for that. So just make sure that you're aware of some of that, because this is just crazy as far as what they are allowing now in that realm. I don't agree with that at all. Our Codecast podcast is also brought to you today by Gold Bond Ultimate Healing Lotion, skin therapy for nourished, healed, and healthy-looking skin. Gold Bond Ultimate. Also, the NSCHBC will be presenting a telehealth 2-day summit on February 24th and 5th virtually. I hope all of you try to attend that. You can find it on the nschbc.org next week. But there, as far as a flyer for it, but we're going to have a great lineup of speakers. Sean Weiss and Eric Rubenstein, David Zetter, myself, Christine Hall, Sonal Patel. We just have a great, we're going to have Brianna Santoli and Amanda Weish, both healthcare attorneys. So just a great lineup of people who really understand what's going on with telehealth climate. And so we'll give you a lot of not only legal positions, but state to state, federal, and what's current, making sure you're billing compliantly, and just everything going on with that. So again, February 24th and 5th, and take a look. And we'll have it on my website as well as a link as soon as we get our flyers up and running. But we've gotten confirmations from all our speakers, so we're very excited about that. Okay, another thing that we want to make sure that you are aware of that actually follows the information I just gave you about the Telehealth Summit. Make sure that you are looking at your state, not just federally, on what's covered. I noticed that just doing my research over the holidays, about 5 or 6 states have mandated some telehealth coverage, but what they did is they mandated it for the payer, and the payer decided not to allow the patient's provider, where they're actually giving panel providers that have never seen the patients. So this is not good. Also, a lot of the audio only calls are now not covered. So make sure that you have somebody in your practice that is looking at the commercial plans and figuring out what to use. I know with Medicare, they switched to G codes. So always make sure that you're looking at what's covered. Otherwise, you could be submitting claims and not getting paid for that. Okay, my coding question today comes from a client that's in New Hampshire. So shout out to you guys up there in the Northeast. So the question basically says, Terry, we have patients that are traditionally not taking their medication. They are cutting it in half, and we're just not sure what to do because they're not recovering. We also have patients that we tell them to go get an x-ray, we tell them to go get some kind of a test, and they don't do that because they either can't afford it or don't have insurance. What do you suggest in that realm? Well, the issue is liability. So you want to talk to a healthcare attorney, first of all. But the second thing is, let's say that they have limited insurance, but maybe they don't have prescription drug plan, or they only have major medical, and so they don't have any diagnostic coverage. There are diagnoses out there that are called social determinants of health. And they also go along the lines of underdosing on purpose, so intentionally. And that's a patient who takes maybe half their medication because they can't afford to take it all, thinking that half is better than none, when, as we know, the doctor wouldn't have asked for a certain dosage if they didn't think that they needed that full dosage to either keep blood pressure under control or whatever, bring down cholesterol, etc. And also, we have patients that end up never getting that x-ray or getting that diagnostic, and then find out later they either passed away or they got worse or something happened. And so really use those social determinants of health diagnoses when you're filing claims, if it fits the scenario or the encounter, because it also falls into the risk of moderate on E&M services. And so those are usually found in the T code section and in the Z section. So make sure that you are taking a look at those and really giving your physician a heads up about those codes, because it can really make a difference between a level 3 or level 4, possibly even a level 5 visit when you're seeing those patients in your office. So really make sure that you're capturing that circumstance in code format, and that'll really help you as well. So I'm going to end with my tidbit this week and for personal information. And I just wanted to let you know that I might be a little sad because my Pittsburgh Steelers quarterback looks like he's going to retire this year. And so I'm in mourning. So I'm hoping that maybe Ben might pull out another year, but he said most likely this is it. And we have Monday Night Football game, and when you'll be listening to this, that'll be over. So hopefully I'll be saying next week that we won, because we still have a short window to maybe get in the playoffs. But I'm sad. You know how much I love my football. So that's what I got to deal with this week. And even on my Steel City Underground What the Football podcast, I had to talk about it, and it was very sad for me. But hopefully 2022 is going to be a great year for many of you. Just remember one saying, and I think about this all the time. People who say that they don't have time for anything are making up an excuse. You don't have time, you make time. And so the only way to get anything done is to make time for it. It's just like making time for leisure activities, for a vacation, to spend time with our kids. I remember years ago, talking to Summer's dad and just my daughter, and just saying, can we really afford to have kids? You can never afford to. You just do and figure it out. So it's a similar concept. Basically, you have to make the time to get things done. And if you keep that focus, then 2022 should really be a good year for you. So everyone, make it a great day and a great week. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.